Measles is a highly contagious infectious disease caused by measles virus. Symptoms usually develop 10 to 12 days after exposure to an infected person and last 7 to 10 days. Initial symptoms typically include fever, often greater than 40 degrees Celsius, and pneumonia. These occur in part due to measles-induced immunosuppression. Less commonly, seizures, blindness, or inflammation of the brain may occur. Other names include morbilli, rubeola, red measles, and English measles. Both rubella, also known as German measles, and roseola are different diseases caused by unrelated viruses. Measles is an airborne disease which spreads easily from one person to the next through the coughs and sneezes of infected people. It may also be spread through direct contact with mouth or nasal secretions. It is extremely contagious. 9 out of 10 people who are not immune and share living space with an infected person will be infected. Furthermore, measles' reproductive number estimates vary beyond the frequently cited range of 12 to 18. The NI quote this 2017 paper saying, "Review in 2017 identified feasible measles R0 values of 3.7 to 203.3. People are infectious to others from 4 days before to 4 days after the start of the rash. While often regarded as a childhood illness, it can affect people of any age. Most people do not get the disease more than once. Testing for the measles virus in suspected cases is important for public health efforts. Measles is not known to occur in other animals. Once a person has become infected, no specific treatment is available. Although supportive care may improve outcomes, such care may include oral rehydration solution, healthy food, and medications to control the fever. Antibiotics should be prescribed if secondary bacterial infections such as ear infections or pneumonia occur. Vitamin A supplementation is also recommended for children. Among cases reported in the US between 1985 and 1992, death occurred in only 0.2% of cases, but maybe up to 10% in people with malnutrition. Most of those who die from the infection are less than 5 years old. The measles vaccine is effective at preventing the disease, is exceptionally safe, and is often delivered in combination with other vaccines. Vaccination resulted in an 80% decrease in deaths from measles between 2000 and 2017. With about 85% of children worldwide having received their first dose as of 2017. Measles affects about 20 million people a year, primarily in the developing areas of Africa and Asia. It is one of the leading vaccine-preventable disease causes of death. In 1980, 2.6 million people died of it, and in 1990, 545,000 died. By 2014, global vaccination programs had reduced the number of deaths from measles to 73,000. Despite these trends, rates of disease and deaths increased from 2017 to 2019 due to a decrease in immunization. Symptoms typically begin 10 to 14 days after exposure. The classic symptoms include a 4-day fever, along with a maculopapular rash. Fever is common and typically lasts for about 1 week. The fever seen with measles is often as high as 40 degrees Celsius. Complex spots seen inside the mouth are diagnostic for measles, but are temporary and therefore rarely seen. Complex spots are small white spots that are commonly seen on the inside of the cheeks opposite the molars. They appear as grains of salt on a reddish background. Recognizing these spots before a person reaches their maximum infectiousness can help reduce the spread of the disease. The characteristic measles rash is classically described as a generalized red maculopapular rash that begins several days after the fever starts. It starts on the back of the ears and, after a few hours, spreads to the head and neck before spreading to cover most of the body, often causing itching. The measles rash appears 2 to 4 days after the initial symptoms and lasts for up to 8 days. The rash is said to stain, changing color from red to dark brown, before disappearing. Overall, measles usually resolves after about 3 weeks. People who have been vaccinated against measles but have incomplete protective immunity may experience a form of modified measles. Modified measles is characterized by a prolonged incubation period, Milder and less characteristic symptoms. A Filipino baby with measles complex spots on the third pre-eruptive day, complex spots on the day of measles rash. Complications of measles are relatively common, ranging from mild ones such as diarrhea to serious ones such as pneumonia, otitis media, acute brain inflammation, and corneal ulceration. In addition, measles can suppress the immune system for weeks to months, and this can contribute to bacterial superinfections such as otitis media and bacterial pneumonia. 2 months after recovery, there is a 11 to 73% decrease in the number of antibodies against other bacteria and viruses. The death rate in the 1920s was around 30% for measles pneumonia. People who are at high risk for complications are infants,